Hello everyone, glad you could join me today as I highlight some tips on managing white cataracts and the dreaded Argentinian flag sign. We are well aware that intumescent white cataracts pose many surgical challenges, but perhaps the most difficult challenge is the creation of the capsulorhexis and avoiding the Argentinian flag sign. The first video is of a young boy with white cataract 3 months after undergoing retinal detachment surgery with oil tamponade. Surgery started off smoothly with proper staining of the anterior capsule. I felt I had adequate viscoelastic to flatten the anterior capsule and proceeded with capsulorhexis. However, disaster struck when I experienced the Argentinian flag sign. Was there anything I could have done differently? Firstly, always ensure good staining of the anterior capsule. Next, ensure adequate flattening of the anterior capsule with your viscoelastic. Aspirate the liquefied cortex to decompress the high intracapsular pressure. More viscoelastic is then injected to flatten the anterior capsule. For the CCC, start small and then slowly enlarge it as you proceed. This will ensure that you have some margin for error if radial extension of the CCC do occur, and you do not end up with an overly large CCC. This is one example of a properly managed capsulorhexis in a white cataract. However, what can you do when faced with the Argentinian flag sign? Take a pause, reassess the situation, and proceed again carefully. Now back to the first patient. Aspiration of the cortical matter was done and more viscoelastic was then injected to flatten the anterior capsule further. New flaps were created using the cystitome on the edges of the torn anterior capsule, and the capsulorhexis was completed in a continuous curvilinear manner. Gentle hydrodissection and delineation was performed to mobilize the cataract. As the nucleus in this case was soft, removal of the cataract was performed using only the IA probe with the help of a second instrument. The posterior capsule appeared intact and the decision was made to insert a single piece IOL into the capsular bag. Note the position of the haptics, which were at right angles to the axis of the Argentinian flag. Viscoelastic was then gradually removed and the wound was hydrated to create a watertight seal. The IOL was centrally located in the bag and there was no posterior capsular rupture. Remember, you always have options when faced with an Argentinian flag sign. Don't give up just yet. Thank you very much for watching.